Hello and welcome to this episode of Medizom, where we will be looking at the topic of building and maintaining perspective. It's such an important skill to nurture as we try and make our way up the medical mountain, so that we don't lose sight of our goals. And we have the privilege of being able to talk about this important topic with Matt Daniel, who I had the pleasure of getting to know a few months ago after his initial interest in my website Medizom. And he has a clear passion for how we can help maintain perspective and ensure that we really enjoy our medical careers and make the most of it. So join me now as we hear from this wonderful man, as we hear how to not only cope in medicine but also thrive. Today I'm very delighted to welcome Matt Daniel. I made sure not to say doctor or mister, because I know you've said before that you're not a fan of titles.
Yes.
So you're an ENT surgeon by trade, but you also have a few more strings to your bow.
Yeah. So I mean, ENT surgery is my first and main job, if you like. And one of the things that happened is during my career, I became interested in a variety of other things also. So became interested in research and medical education and also coaching. And at the moment, I'm managing to combine all of those things in one fashion or another. So I'm continuing to do research and particularly interested in a variety of different things, but at the moment looking at medical devices research and clinical trial research. I'm interested in medical education, so I'm the undergraduate lead for ENT at our university, and I coach also, and I mentor on our consultant mentoring schemes. I coach through the leadership academies, and I have an independent coaching practice also.
Fantastic, yeah. And do you manage to find enough time in the week just for yourself to relax with all that going on?
Do you know I do, Ross, and it's an interesting one because I suppose it depends on what you mean by relax. And I think different people have a different version of relax. So if you say do I spend many hours a week sitting on the sofa watching television, the answer to that is no. But that for me isn't relaxing. So the okay, sort of what do I do for relax? You know, I run 5 times a week. I exercise every day of the week. I walk the dog. I read. Obviously, in the days before COVID, I would meet up with friends. So they would be the things that I would see as relaxing rather than necessarily sitting and doing nothing. So I do like to sleep. So I probably like to sleep at least 9 hours. So maybe where some people might watch television, whereas I just sleep. So
Fair enough, yes. I guess it's making that distinction as well, because I think a lot of people find it's a difficulty with finding a work-life balance. But when actually you enjoy the work and find your work exciting, it becomes your life. And a lot of people don't like that phrase work-life balance, because it often would then, by definition, mean that you find enjoyment in one aspect and you need to fill it with something else to make that part bearable. And
yeah.
I think that's I guess our paths have crossed because we seem to have similar mindsets with regards to what a career in medicine should be, and it should be on our terms, and it should be fun and an adventure. And we spent quite a few hours in our first encounter on a Zoom, just sharing our experiences and the pitfalls that we've both fallen into with medicine. And I guess trying to focus our conversation for today, I wanted to discuss how we consider how we at first build perspective and then maintain that perspective, and how sometimes our perspective changes. And I guess just to introduce viewers to what I mean by perspective, I've shared with you that analogy of thinking of medicine being like this challenging but beautiful mountain that you have to climb, and everyone's path up it is possibly at the start quite similar, but then diversifies once you got out with your initial sort of internship training. And so, yes, I was wondering for yourself then, what, how did that getting your feet onto the mountain? How did that look like? How did you initially view that mountain of getting into medicine, and how did you find your feet to begin with?
Ross, probably I'd start by picking up on the concept of work-life balance if we're talking about perspective, because even the term work-life balance suggests that work and life are two different things. And probably where I'd start for me is that for me they're not two different things. Work is part of my life, sort of in the same way that running is part of my life, or going out with my friends is part of my life. So when we even the idea of a work-life balance immediately sets up a tension between what is work and what is life. And I think probably how my path at the beginning started is I never saw work being different from the rest of my life. Work was part of my life. It was an important part of my life, but it was a part of my life. So I think the way that I probably would see my beginnings, or at the bottom of the medical mountain, would be that I was probably or where I wanted to end up. And that's something that actually stood me, I think, in good stead for a large chunk of my career, because I recognized that there was somewhere where I wanted to end up, or there was something that I want to be doing. And that for me was something that was very motivating, because it allowed me to overcome, the difficulties and the challenges that inevitably come along with any career. And by having that very firm focus on where I was going and where I wanted to be, then all of those challenges were probably much easier to manage. There is an issue with that kind of mentality, and I know we chatted about this idea of a fixed mindset, sort of, as opposed to growth mindset, and what I've just described is a fixed mindset. So there's I have to pass exam, tick. I then job, tick. I passed the exit exam, tick. I become a consultant, tick. So, and I think that our careers are ruled by a conveyor belt where we move from one target to another. And whilst that is in many ways helpful, because it allows us to progress our careers, and indeed we are selected for our ability to tick those boxes and progress the careers, is I think sort of along the line, people often forget that actually that there's a job to be enjoyed, and irrespective of whether you're ticking all the boxes or not, you're doing a job, and there's a job that you can enjoy on a daily basis. And probably the way that I would see is, I think, while certainly I did have very much a mindset that these are set boxes that I had to take, I probably also very early on had a recognition as to what was it that I wanted to do every day. So for me, it was two things. Was, where is my career going? Where do I ultimately want to be? But there was also around, what am I going to be like today? And both of those things, I think, for me, were important. And the issue of the where am I going and which boxes am I going to tick, that's very much ingrained in the medical ethos and the medical mindset. I think the who am I going to be today? How am I going to enjoy my job today? How am I going to behave today? What choices I'm going to behave today? That is probably a little bit less ingrained in the traditional medical mentality. And I think for me, that probably came because I ended up in medicine via a slightly circuitous route, and that in itself meant that before I even entered medicine, I very clearly examined and very clearly had views in my mind about what it was about medicine that attracted me to it. And I thought some people probably go on the conveyor belt from school to university and
Hmm.
then onwards. And if they never stop and pause and examine what they're doing, then potentially that can be an issue. But if you pause and stop and say, what is it that I'm doing? What am I doing today? And where is my life going over the next 20, 30 years? Those will be the things important to me.
Yeah, I think some people often just fall into medicine because there's that expectation from school. If you've got the grades and you have some iota of people skills, it's kind of a done deal. And particularly if your parents are perhaps in the medical profession as well.
Mhm.
Did you not fall into it then? Did you have an expectation after leaving high school that you would perhaps pursue something else? And did it then emerge from the thing that you were doing that medicine actually was a calling?
So I'm not from a medical family, and there are no people in my family that have been doctors, and I probably always had an interest in doing something medical related. And in fact, sort of, I can probably link it back to probably being about 10 and having a family member who was studying to be a vet, and I remember sort of as a 10-year-old going and spending some holidays on their farm and playing with syringes and stethoscopes and surgical masks and being really interested sort of in all of those aspects. So I think it was something that was always within me, sort of an interest in health and an interest in human nature. Um, then I grew up in Slovenia. We moved to England, and when I moved here, sort of the initial careers advice was that because I was from an immigrant family, that medicine was too difficult and I was never going to achieve it. So I actually ended up not so I ended up not applying for medicine, and I took time out. I went sailing first of all, which was lovely, and sort of that kind of allowed me some time to discover what life to be about. And then I worked as a phlebotomist, and then sort of said, actually, I ended up, I ended up going from A levels to working in a hospital, and then realizing that actually medicine is what I wanted to do. So I then reapplied. But I think for where my journey was different to certainly a lot of my peers. I mean, I started medical school in '93, so it was a long time ago. No graduate entry medicine in those days. Yeah, everybody went straight from A levels to university. So where I was probably different to most people at that stage, what was that I had actually consciously stopped, paused, analyzed, thought, and consciously decided, yes, this is where I want to be. And I think that's the key, really. As you've alluded, sort of some people are just on the medicine conveyor belt, and it's just what they do, and they never really think about it. And that there's nothing wrong. That's how you've been brought up, or that's what the expectations are. At some stage, though, you need to sit down and examine and say, okay, what is it that I want to be doing? Because unless you examine your own values, your own beliefs, your own motivations, then at some stage in the future, when things are difficult, you're going to find it's difficult. You're going to struggle, because unless you have a really clear idea of what your motivations are and where your life is going. Medicine is hard. All careers are hard. Yeah, so not just medicine. So to all careers are hard, and unless you have a really good reason, what is it that gets you out of bed? Where are you going? Where do you want to be? What kind of a person you want to be? If you've not got all of that very clearly sorted in your mind, when the challenges come, it becomes overwhelming.
Hmm. And you said that you had quite a clear idea of where you wanted to end up. How specific was that? Was it to the point of knowing that you wanted to be an ENT consultant and do teaching, or was it just a general you wanted to be a surgeon? Or
No, not even as specific as that. Yeah. So this is going to make you laugh, Ross, but I wanted to change the world. So
well,
you
there you
know, how,
go. Yeah, of
I
course.
mean, how ridiculous is that? Yeah. If you'd asked me when I was 20 what do I want to do, I probably would have said something like that. I want to help people. I want to make a
Yeah.
difference, and I want to change the world. So I think that that having that kind, and actually sort of the still that very broad sort of ambition of one life to be about. And so sometimes if things are very specific, so some people have very specific ideas about what they want to do, and that's great. I think I think most such specific ideas. I personally don't, and I think a lot of people don't know exactly what they want to do, and that's okay, because what matters is what kind of a person you want to be, what kind of a difference you want to be making. Yeah, and if I said I want to be making a difference to people around me, well, I can do that as a doctor, and I can do that as an educator, and I can do that as a researcher, and I can do that as a coach, and I can do that sort of when I meet up with my friends at dog school, and I can do that when I go to the running club. Yeah, so they're all different ways that I can be making a difference to other people around me. So I think what I had was a very broad idea of what I wanted my life to be about and what I wanted to do. The specifics, to me, they're not that important, to be honest. And you say, okay, I'm an ENT surgeon, I take out tonsils, after you've done your first 1,000, it really isn't that interesting anymore. Yeah, so I don't go to work saying, oh, I'm really looking forward to taking those tonsils out. Yeah.
Yeah.
Oh, I'm looking forward to making a difference to that child's life. Yeah, the
Yeah.
tonsils, that's just a tool that I have to make a difference. Yeah.
Yeah. Uh-huh. Right. Yeah. I guess I mean, when you look at the mountain, you don't know what view you're going to see from the top, and I think you're always going to be disappointed if you try and draw what that view is going to look like.
Mhm.
It's an action that's quite impossible to do from where you are from that perspective.
Mhm. Mhm.
So I guess in terms of building the perspective that you did, it was one of chasing not ultimately the destination, but a particular feeling that you were wanting to to be able to bring to your everyday work, one of giving back, one of finding a reward and having an impact in people's lives. At what point going up the mountain do you think you achieved that? Was it at medical school, or did it come later, or only as a
Uh,
consultant?
No, actually at medical school, yeah. Sort of, if we say fundamentally, if it was about wanting to make a difference to others, at medical school, yeah.
Mm.
And I'll in fact can tell you, it would have been in my psychiatry block at medical school. And I worked for a professor of mother and baby psychiatry at the inpatient mother and baby unit, and there were staff shortages, and there were mothers that had been discharged, and they had to be followed up. And the professor gave me a file and said, can you drive 30 miles to Wolverhampton and do a home visit to this mother that was discharged last patient's notes. And I drove 30 minutes to Wolverhampton, and I spent an hour talking to this woman and seeing how they are. And then I drove back, and I made it, and I reported back to the professor, who then sort of took further action based on the history that I provided. Yeah, and I'm not sure that kind of would happen. I don't think that would happen anymore these days, probably.
No.
And I did a very good job, yeah, of it. And also it was probably something that very early on I kind of sort of said, I have really made a difference to that person, because that person would not otherwise have had a visit from anybody. Yeah.
Mm.
But I remember very early on making a difference. And then probably one of the reasons that attracted me to ENT was I did ENT as a house officer, so that would have been in 1999. And remember having my training and induction, and then seeing people where I was hoovering out their ears, I was removing fish bones, I was cauterizing noses, suturing lacerations. And sort of, and very early on in my career, I said, I'm doing this, and I'm making a difference. Yeah. And
Mm.
sort of, and I wasn't particularly high and mighty, and I wasn't anybody important or anybody special, but I was making a difference to the person in front of me. And I think sort of probably that one-to-one connection with the person, me and colleagues around, I think that's something that I've certainly valued, in my life, and that's something that's kind of stayed with me. Yeah, that yes, there's somewhere where I ultimately want to be going, but there's also somewhere where I am today, and focusing on where I am today and what I'm doing today and what difference I'm making today. I think
Mhm.
that's something that's really powerful also.
Yeah. And I suppose this question's quite a big question, but it's, do you think that there are particular things that have been helpful in keeping that perspective going? And do you also think there are some things that are hindrances to that within, maybe initially talking about medical school, but also within training after you've qualified?
Yeah. So one of the things that I've already alluded is this idea of really re-examining what is it that you're doing. Yeah, you know, what am I in medicine for? What do I want to be doing? So that's something that was helpful. And I think one of the things that's helpful also to me is a kind of a dual focus on what am I doing today to the person in front of me? How am I treating the human being in front of me and my colleagues around me, as well as thinking, okay, you know, where's all of this going? So having some kind of an idea that there's a future and there's the kind of person that I'm becoming and the kind of career that I'm creating for myself in the future. So I think that's something that's been helpful. So in terms of hindrances, again, you know, if people don't examine what they're doing, if people are just on the conveyor belt, that becomes a hindrance. I think a focus on tick boxes and targets, and I think that to my mind has taken people away from the enjoyment of the job and the day-to-day interaction. And I understand that, of course, people have to have ARCPs and people have to do WBAs and 360s. I think one of the things that concerns me is where people's entire jobs revolve around passing all of those assessments, passing the WBAs, passing the 360s and the ARCPs, and the focus shifts on the ARCP instead of the job that you're doing. And it's the same as university, you know, sort of there's learning and then there's exams, isn't it? Yeah. And, you know, they're both important. Yeah. But the learning is probably more important than the exam. The exam is evidence of your learning. But I suspect somewhere along the line, you know, I think as a I don't know, as a culture, we've forgotten that life is about learning and we think life is about exam. And I don't, when I was doing A levels, of course it was important, but I don't ever remember it being as important as it is to the teenagers that I know now. And I think that's probably a societal level that we judge people on exams, we judge people on what degree they have, and those things. And whereas in reality, I think sort of if life was more about learning and exam was evidence of learning rather than it being about learning, that probably would be better. So of course, you know, you have to show that you've passed, you have to show that you're competent. So I understand all of that, and all of that's important. I also think people choose where they put the focus. Yeah. So, you know, people, doctors that are foundation doctors, or core trainees or higher trainees, they make a choice in where they focus. Yeah. So, you know, there's you have to pass your ARCP, yeah, but passing your ARCPs, I don't think it's that difficult, is it? So, you know exactly what you need to do. Doing the exams is probably difficult, yeah. But sort of for the other thing is, you know, you turn up, you do a good job. That's what's required, isn't it? You know, you turn up, you show you're a competent doctor. There isn't any magic to it. So it's same as for consultant appraisal, yeah. Is, you know, you have to show that you're a good doctor. But if you turn up and you're a good doctor, then you are a good doctor. Yeah.
Mm-hmm.
So, you know, you don't have to go out of your way to try and prove how good you are. It's much easier to just be good, yeah, rather than trying to prove how good you are, yeah. But people make a choice as to, you know, where they put the focus. And, you know, if I give you sort of an example that saddened me was a trainee that wanted to do an audit of one of our internal guidelines. The audit would have been really important because potentially to identify how we're doing with following the guidelines and implementing change. and I was suggesting that we need to do the audit properly so that we can genuinely make a difference to the department and the patients. And the person that was doing the audit effectively said they're not interested in doing it properly. They need to do it so they can get a tick box for the portfolio to say they've done it. Yeah. So from their point of view, they couldn't care about this making a difference to patients or making a difference to the department. They wanted to do something as quickly as they can, as simply as they can, so that they can just get a tick in their box. Yeah. And whether it's of any relevance to patients or the departments, that was of secondary importance. Yeah. And that was a really sort of sad example for me. That person made a choice. Yeah. That person made the choice of what kind of an audit they're going to be doing, and that person made the choice that they're going to audit that's going to take a rather than an audit that's going to make a difference. Yeah. But that person did make that choice. Yeah. So we're all making those choices all the time. So if we stop and say, okay, what choice am I making, then we can make the kind of choices that take us closer to being the kind of people that we want to be.
Yeah, I think that perspective of your junior is probably shared with quite a lot who feel that a lot of their career is based on jumping through hoops, and this is just one more hoop to jump. And unfortunately, sometimes the magic of what a reflective piece or portfolio could give you is kind of shrouded in it's taking up more time away from my life outside of medicine. And I think that's when medic zombies are generated, particularly thinking about the growth mindsets and the fixed mindsets. It's those with the fixed mindsets that really do struggle the most, because, and I think particularly considering the conveyor belt of medicine, it's a lot easier at the start, where your success is easily reflected with the exams that you take, and any praise is given quite obviously in the way of more letters after your name and so on. Whereas it becomes a little bit more abstract on a day-to-day basis. As a doctor, you're not given a gold star when you see a patient and you're able to communicate the risks and benefits of an operation, for example.
There's an issue there, Ross, that I would pick up is if people are expecting that that every time they do something that's good, that somebody is going to praise them. One question that I would ask is where's that thought coming from? Yeah. So the first question that I would have asked, where is it written that every time you do something good you get a gold star? Yeah. I mean, there's no law that says that, does it? Yeah. And you know as well as I do that some people get gold stars all the time, and sometimes good people get gold stars, and a lot of time not very good people get gold stars. Yeah. And you don't need to look very far. You open the newspaper, you look at who rules the world. Yeah, the people that rule the world, are they the kind of people that you and I would give gold stars to? Yeah, probably not. Yeah, but I wouldn't give a lot of the people that rule the world gold stars. Yeah, but they do rule the world. Yeah, so so there's no law that says that you are good and you do a good job and the world owes you a gold star, because the world doesn't owe you a good gold star. Okay, so that's one thing. The other thing I would say is where does the feeling, where does the validation come from? Yeah, so is it you've done a good job, and you've done a good job, and you get satisfaction from the fact that you've known that you've done a good job, and and that's powerful, and that's enough. I know that I've done a good job. I don't need anybody else to tell me I've done a good job. I don't need a sticker or a gold star because I've done a good job. I know I've done a good job. I've made a difference to the person in front of me. So it perhaps goes then to a sense of what difference I'm making and a sense of my own self-worth. Because if I'm lacking in my own self-worth, if I don't myself recognize the difference that I'm making, then I'm looking for other people to give me that external validation. Yeah, and and sometimes it'll come and sometimes it won't come. Yeah, and of course it's normal. Yeah, we all like to have stickers, don't we? We all like that. Yeah, but fundamentally, one of the questions that I would say is instead of relying on other people to give you rewards, so to say to yourself, I've done a good job, well done me, pat on the shoulder, I can do that for myself. I don't need to do that from anybody else. And it perhaps goes down to sort of this idea of valuing, treasuring each individual interaction sort of with people around you, and I would kind of refer to seeing people as roadblocks or seeing people as rainbows, sort of, because you could say, or seeing, if you work in A&E, you've got two choices, isn't it? Every person is a roadblock that you have to overcome so that you can get to the next one, or sort of, or if you're a junior doctor, you have to put a cannula. Every cannula is just another roadblock you have to overcome until you can get to 5 o'clock and go home. But instead of seeing people as roadblocks, if you see people as rainbows, you say, this person, there's somebody's dad, there's somebody's mum, there's somebody's brother, sort of, there might be somebody just like me, might be looking after my mum and dad, or my nearest and dearest in that way. And, and you try your best to interact with everybody, as a human being, and you recognize that individual interaction with that individual person matters. That one-to-one interaction matters. I mean, don't think I always get it right, Ross. So I'm sounding very idealistic. Sort of, if I said that I see everybody as a rainbow, I'd be lying, because the reality is, sort of, we all have bad days.
Yes, of course.
So I'm giving an idealistic view, sort of, rather than something that I can necessarily achieve. But if you ask me what I aspire to,
strive for.
I strive for each person, each interaction that I have with another human being, to try and make that interaction positive for them in this best way that I can. I can't always achieve it, but that's my ideal.
Yeah, that's a really good analogy, actually, and I think it is part of, again, not becoming a medic zombie. I think medic zombies would generally see every, not just patient, but every possible referral to a specialty as a roadblock. Whereas I think my resilience certainly comes from trying to delve a little bit more under the surface with a patient and establish that connection. And I enjoy my work much more for it, and I think the patient gains something a lot more for it as well, because they actually see me as a doctor that's trying to understand their pain, their suffering, and also when I'm on the phone to relatives, I sympathize with the difficult situation, particularly with COVID, that they're not able to be there with them. So actually seeing it as a rainbow, as a chance to see the humanity in it, it deepens my purpose and my love for the mountain. And I think as soon as that goes, as soon as that is taken away, it becomes almost an insurmountable challenge, because as soon as your perspective goes to one of battling and fighting and defensiveness, your progression just slows. And I guess that's, in terms of perhaps what we can maybe begin to talk about now, is that changing perspective. And I guess you, as with your hat on as a career coach, must see this quite a lot, where you see people that see every situation as a roadblock, and see all their colleagues as perhaps a point where bones of contention that are easily arise. How do you help those people change their attitude?
Mm-hmm. So one of the things that I would say, Ross, is that there's an element of that kind of career distress in all of us, I think. Sort of all of us have different ways of dealing with that. But we have challenging careers. If you're a trainee doctor at the beginning, it's challenging. If you're a consultant, it's also challenging. Sort of, and and if you're a nurse or a hospital manager or a speech therapy, they're all challenging roles. So all of us face challenges all the time. So the first thing that I would say, I would say that it's normal to have times in your career when the career is challenging. It's normal that circumstances change. Perhaps you have ill health, or your career progression changes, or you have family circumstances that change, and all of that changes your perspective on life, and all of that, to my mind, is entirely normal. So I think in practical terms, there's probably a couple of things that I find very useful in terms of how I would approach career satisfaction, or issue around a decision of what kind of a person I want to be. And fundamentally it goes down to trying to establish what motivates people, what drives people, and what people want out of life. Yeah. And we all want different things out of life. Yeah. And there's nothing wrong with any of them. Yeah. It's not that there's a right thing to want or a wrong thing to want. Yeah. Some people want to have a job that is relatively 9 to 5 because they want to spend more time with the children. Some people want to have a job that's exciting, that takes them all over the world, and they don't want to see their families. That's fine also. Some people want the flexibility of doing odd A&E shifts here and there, and working nights and weekends, because that gives them time to do something else during the week. All of those things are fine. Yeah. But what's important is that people consciously sit down and think, what is it that I want out of life? What kind of a person do I want to be? How I want to behave? How I want to act? And where do I want my career? And whole life includes my career, yeah, but where do I want my whole life to go? And then once people know that, it then comes down to making choices, yeah. And you go to work, yeah, you can see a person as a roadblock, or you can see a patient as a rainbow, and you have a choice. Yeah, and you make that choice. Yeah, sort of whether you know it or not, sort of you do now, but whether you know it or not, you're making a choice of how you're going to treat that patient. Yeah, and that choice might be made unconsciously, but you make a choice in how you're going to treat that person. You make a choice in how you're going to be interacting with the people around you. You make a choice of how you're going to be at home. You make a choice as to what kind of person you're going to be to the team around you. And it then comes back to a set of skills that enable you to be making those choices. Yeah. So recognizing what kind of a person you want to be, that's the first thing that then allows you to say, okay, I choose to be this kind of person. Also, you have to make difficult choices, and when you're saying yes to certain things, you might find that you have to say no to others, and you might have to accept that. Yeah. So I might say, I choose to spend more time at work, and I choose to take on more duties or do an additional degree, and in saying yes to that, I'm saying no to more time with my family. Yeah. Or I might choose to say I want to spend more time with my family, and because I'm saying yes to my family, I'm saying no to doing a PhD, for example. Yeah. And I mean, they're both fine, aren't they? Yeah. Sort of, but is you choose certain things, you say yes to something, you say no to the other thing. Yeah. And then sort of course, then the third thing really would be around being able to recognize, what happens when, what kind of stuff triggers you, what kind of ideas trigger you, what things happen that tend to pull you in the direction that you don't want to go. Yeah. And sort of a classic one might be, you're busy in and sort of, and it's correct in the way the bushy brain says, oh my God, everybody's a roadblock, I just want to push them out of the way as quickly as possible. Yeah. But then sort of say, okay, if there's a 4-hour waiting time, what happens is I treat everybody in this way. And you say, actually, I choose to treat people well, even though there is a 4-hour waiting time. Yeah? And the reality, of course, is that being nice to patients probably take less time than treating them as roadblocks. Yeah, I mean, it doesn't take any more time to talk to people. It doesn't take any more time to be a human being at work than it does to see everybody as a roadblock. And certainly, in the medium and the long term, being human at work is going to give you really, really big payoff from your colleagues, if not from your patients. Yeah, there's probably sort of a kind of a looking at the world from 4 different angles that might be helpful in this. So when people are reevaluating, what's happened, what are they not happy with, and where do they want to go next, and sort of, and if you try and look at your world through 4 different lenses, if you like. So, and the first world that I would say would be the physical world. So that would be your physical body, and that would be the physical environment. So that is, are we looking at ourselves? Are we eating healthily? Are we exercising? Are we doing yoga? Or, are we eating crap? Are we eating late at night because we're too tired to cook? Are we not exercising? And do we go out? Do we connect with the environment? Do we spend time in gardens if we're lucky to have one? Do we go to the park? Do we go and walk in the mountains? And the physical world around us is sort of something that is really powerful, that if you're physically healthy and if you're connected to the environment around you, that's something that's a really powerful support, if you like, that helps you get through the challenges. Yeah. And probably another similar one there would also be relationships around us. Yeah. So again, if somebody has career dissatisfaction, or they're exploring saying they want to do different careers, or they're not sure what they want to do, or they're not happy in their career, what kind of relationships are you having at work? Yeah. And we talk a little bit about how you see patients and the kind of relationships you have with patients, but also then that goes to relationship with your colleagues. Yeah. Because if you love your colleagues are going to love you back, and that's going to give you support at work, but also with your nearest and dearest at home as well. Yeah. So, they would kind of be two of the worlds that would support you in making those decisions, that would carry you when the time becomes difficult. So, your physical body, physical environment, and your relationship. Yeah. So the third world that I would examine would be kind of your inner personal world of your thoughts, your feelings, your emotions, and what's going on inside the head. And that's probably a slightly more difficult one, but it's something that's important to unravel. So that would be an examine of, say the example of, there's a horrendous wait in A&E, and then as a result, I end up just trying to push people out of the way as quickly as I can. Yeah. So say, what's behind that? What's your belief? What's the reason that you act like that? What's going through your mind? What's your mind telling you when that happens? When you think, oh my God, this is going to be horrendous, I'm just going to try and push everybody out of the way. What's going through your mind, and what your mind's telling you? So in examining a little bit about your thoughts and your beliefs and your emotions, what kind of emotions turn up, or if you're angry at work, or you've fallen out with colleagues, you've had disagreements, just recognizing what are those emotions, what are you thinking, what are you feeling? And and emotions are data. Your emotions are telling you something. And I think in medicine, a lot of the time, the emotions that we experience suggest that something is going against our values. Yeah. That's yeah. If I have emotions at work, usually that's because something's going on that is very much against what I believe. There's something's going on which is, in my view, wrong. Yeah. And of course, in your view, that might be right. And in somebody else's world, it might be right, because, you ask 20 people for an opinion, you're going to get 20 different views. But my emotions, to me, signify their data that tell me that something's going on that disagrees with what I believe in. Yeah. So that's kind of the third world then. So that would be your thoughts and your feelings. And the fourth world, I would see, would be the world of spirituality, or the world of belief. And in that, I'm including our values, and our missions, and our ambitions, and what our life's meaning is all about. Yeah. And and meaning in life, sort of, for some people that will come through religion, in other people that's going to come from the values that they believe in, or it's going to be a mixture of both. Yeah. And it's a very individual thing. Yeah. Life, yeah. But knowing, again, being very certain, what's my role in life, what's my mission in life, what I want my life to be about. And that's a decision that I make. Yeah. So nobody gives me, nobody says, here you go, Ross, this is your mission in life. Yeah. Life doesn't work like that. Yeah. You don't get an envelope that self-destructs that says, this is your mission in life. Yeah. You create your own meaning in life and your own mission. I've created my own meaning in life and my own mission in life. Yeah. But knowing what I've created, knowing where I want to be, and that's the broad thing, and not the specifics as to what I want to have tomorrow, or what exam I want to pass, or what I want to achieve. That's the broad things. I want to make a difference. What we started with, those kind of broad principles, my life's guiding principle, that will be the fourth thing. And I think if people are dissatisfied at work, or they're facing challenges, they're wanting to make decisions, they're contemplating career change, then sort of, looking at it through the physical world, the physical in their environment, the relationships that support them, their inner world of thinking, feeling, and emotions, as well as their meaning and their spirituality. Those kind of four lenses would be something that I find helpful in examining what's going on for that person, and indeed where they want to go next, and where they want to make changes.
Hmm. Okay. Yeah, I mean, I think personally for me, when I found difficulty, it was probably the third lens, thinking about the relationship towards myself. I think if I was unable to find compassion or forgiving a certain way of feeling internally, then I was unable to project compassion outwards uh, to the patients. So when my well of compassion had run so dry for myself, and I was kind of questioning what I was doing it for, and it's taking too much away, then it feels really uncomfortable to try and give compassion to someone else when it isn't there. And when I felt particularly like that, even just hearing someone talk about their own ailments or complaints, I almost wanted to put my fingers in my ears and say, no, I can't take anyone else's pain. I'm dealing with my own personal pain just now, and it's too much in my resting on my spirit to take on anymore. Otherwise, might break completely. Have you ever reached that kind of point yourself, or have you seen that in other people before?
Yes and yes. I mean, Ross. It's a work in progress. Yeah. So
Hmm.
so the medical mountain for me, it's important that I know there's a top of the mountain there, and that's vaguely where I'm heading. But it's about the journey. Yeah. And as I said, before, with the roadblocks and rainbows, I don't get it right all the time. I don't think anybody gets it right all the time. Yeah. And it's we need to, what the biggest tool that we have when we go to healthcare, when we treat patients, the biggest tool that we have is us. Yeah. And sort of, and perhaps 40 years ago, when we didn't have sort of all of these amazing drugs and the amazing treatments that we have now, half of the drugs I have no idea what they are anymore, because they've all changed since I last did pharmacology. Yeah. But sort of now we have all of these wonderful solutions. We have all of this technology sort of that we can offer that makes people better. Whereas in the past, doctors recognize that the most important thing they have is themselves. The doctor is the instrument, the therapeutic consultation. And I think that for me has gotten lost a little bit in the present climate, that we focus on the technology, we focus on sort of everything that we have available, and we forget that the most important tool that we have is the doctors and the staff. So I mean, I think it's been recognized more, and just you probably picked up the news a day ago that sort of that half of all intensive care unit staff are either depressed, have post-traumatic stress disorder, or are drinking excess alcohol. And for me, that's completely the world around me that I recognize also. And I don't even work in intensive care. Yeah. But there's a huge amount of stress and burnout sort of all around us, for whatever reason. Sort of our workplaces are so incredibly fast moving, so incredibly stressful, that it leads to burnout in ourselves. The most important thing that I would say, the most important thing that I bring to any patient is me. And the most important thing that you bring to the patient is you. And if I'm not healthy, and if you're not healthy, you're on a hiding to nothing. Yeah. And it doesn't really matter, how beautifully I take tonsils out, or how well I can prescribe a certain dosage of a certain drug. Yeah. The most important thing that we bring to the patient is ourselves. Yeah. And I think, over the last year or two, there's probably been a much greater recognition sort of that is important, and that's good. I'm troubled a little bit by how we're going about it. Yeah. So because the way that we're going about it is we're putting in fixes. Yeah. So I'm going to send you on a course to be more resilient. Leaflet about emotional well-being. Sort of, here's a website and an app that you can go to be happier. And I probably would want to see a slightly different attitude, which is how are we working? Who are we as individuals? Who are we as a profession? Who is the NHS? What are the NHS cultures and values? And sort of, and rather than trying to fix burnout by sending you on a course on resilience, I would probably rather have a real fundamental discussion around who are we as professionals, what kind of human beings we are, and what's the culture in the NHS that we have. Yeah, because if we have a culture that values individual, if we have a culture that recognizes that the environment is stressful and mitigates stress by reducing stress, not by dealing with the after effects of stress. Yeah,
Yeah.
sort of. I think that's something that would be important. Yeah, and I think the courses on resilience, the well-being support. I think all of those things are important, and that is a more immediate area that we can deal with. Yeah, because clearly we're not going to change stresses in the workplace overnight, whereas you can put on a resilience course overnight, pretty much. So all of those strategies are good, and I'm glad that we're discussing it, and I'm glad that we're putting in things that are going to address the after effect of workplace burnout. I think in the long term, I probably want to have much more of a discussion around, who are we, what leads to all of these things, burnout, who are we as a profession, how do we behave to each other, how do we treat each other and the patients. And I think that kind of really fundamental discussion around who we are as doctors, and to me, a recognition that the most important thing that I have is me, that's the kind of debate that I would want to be having.
Yeah, I mean, I suppose it's analogous to thinking about a physical disease, like putting the focus on the prevention first is like a public health strategy. It's, well, why don't we actually think about reducing the staff workload, changing our merits, what we're eventually trying to end up with. I mean, you made the point that often it's a problem with agenda, and the government has a particular agenda that they want to see X amount of GPs within X time frame, whereas that's not the agenda at the grassroots level.
Yeah. Sort of why would somebody who's 23 straight out of medical school, why would you rush to be a consultant? Yeah, okay, you can become an ENT consultant when you're 35, and you can spend the next 40 years of your life taking out tonsils. Yeah, I mean, just travel, go and do other stuff, sort of try a range of different specialties, see what other worlds are like, and then choose your specialty. And that's how it used to be in the past, Cross. So I mean, I didn't choose ENT until I was probably 5 years after graduation before I chose ENT. I mean, I had an inkling that I would enjoy it because, of course, I did it in my very first year after I graduated. So I thought, oh, this might be interesting. But, I did a variety of other stuff that ultimately cemented my happiness in the decision that I've made and my security in the decision that I've made, and also made me a better doctor, because by the time that I ended up in ENT, I'd done 6 months of A&E, and I'd done general surgery, and I worked in a high ICU. Those kind of things allowed me ultimately to be a better doctor and have a broader perspective. Yeah, a choice of different ways of being. Yeah, the focus on the focus on regulation in ensuring that we're good doctors. I recognize that's important. The ARCPs we talked about. Yeah, sort of that's important. All of those pieces of paper are important. Yeah, so I'm not negating that, but the effect of that regulation is that what we've created is the generation of doctors who tick boxes. Yeah, because you're going to get assessed and promoted on how well you've ticked your boxes, and the result is you focus on ticking boxes. It really isn't rocket science, is it?
Mm-hmm.
Yeah, we've assessed you on how you tick boxes, and what we create is a generation of doctors who ticks boxes. Yeah, instead of thinking, okay, how am I going to enjoy my job today? So, and I mean, I don't think that I know the answer. Of course you have to have regulation, and of course you have to know how people are going to get promoted or selected. All of those things are, I'm not saying that. It's just a recognition that the effect of those kind of systems are a generation of doctors that go from one box to tick to the next. So,
yeah. So, in terms of trying to confront that change in perspective that doctors have of ticking boxes to one that is more of actually just the fundamental doctor-patient relationship, how do you think we start changing that? Because obviously, as you allude to, that the tick boxing in some respects does have an important function to ensure we have safe doctors, but how do we swing it from that one extreme to the other and find some common ground?
I think what we've not done as a profession is encouraged, enabled, taught individuals to examine their own motivations and their own choices. Yeah, and I'll go back to what kind of a person you want to be. And then it's a question of, making choices. Yeah. So, if you want to be the kind of person that wants to travel, you want to enjoy medicine, you want to enjoy patient interaction, you want to see a variety of different things, you want to travel the world, that's who you want to be. Yeah. That's a choice that you make. The flip side of that is you're not progressing your career as quickly as your peers are. Yeah. And that's a choice that you've made. Yeah. And I'm not sure that we have those kind of discussions with people, yeah, because the prevailing narrative is you need to get on as quickly as possible, yeah. You need to apply, why are you not going from F2 to ST training, sort of why are you doing an F3 year and an F4 year and an F10 year, yeah. So it's the prevailing narrative is you need to go through the ranks as quickly as possible, and that's the medical model, that's the sort of mountain, if you like,
Yeah.
sort of we're going up and we're going from one career to the next. So what we haven't done is, I don't think, or certainly I don't think that I don't think there's discourse and narrative around that, is we haven't enable people to say, okay, what kind of a doctor do you want to be? What would you want your life to be about? And then say, okay, this is what you want to do. These are the choices that you're making, and these are the consequences. And the consequences are that you and you alone are responsible for the choices that you've made. Yeah, and that's terrifying. Yeah, sort of if I said to you, okay, you're an F2, you make a choice, you want to travel and see the world and do a variety of different things, but you're responsible for your own career, and you think, okay, that's scary. It's much easier to say, oh, I'm just going to go and do training, then Mr. Daniel's responsible for my career. Yeah, so or the GMC is responsible for my career, or health education English is responsible for my career. Yeah, so it's easier to just go with the flow, because if you step off the conveyor belt, then you're the person that's responsible for your career, all the good bits of it, but also all the bad bits. Yeah, what happens if you can't get back in? Yeah, and 5 years later, all of your colleagues are going to be qualified GPs and consultants, and and you're still a trainee, and how's that going to make you feel? Yeah, so they're all your responsibility, and that makes them terrifying. It makes them powerful, because you do have a choice in what you want your career to be about. So it's great that you have a choice, but the flip side is it also makes it terrifying, because you and you alone are responsible for the consequences of that choice. And also those choices are going to close some other doors. Yeah. So, if you want to travel, see the world, do a variety of different jobs, you're not going to be a GP principal or a consultant as quickly as some of your colleagues will be. Yeah. Or conversely, if you choose consciously to climb the conveyor belt, then yes, you're going to become a GP and a consultant quicker, but you will have missed out the opportunity to maybe travel. When you're in your 20s and you don't have children, you can probably go to Australia, you can travel the world, you can go to Africa and work for MSF for a year. Could you go to MSF for a year when you're 40 and you've got kids at school? Probably not. Yeah. So if you've made the choice that you're going to go and sort of stay on the conveyor belt, then you've closed the door to those experiences that you can have. When you're 60, it's probably quite tiring to go to Africa and live in a tent. But when you're 25, it's probably quite an adventure to go to Africa and live in a tent. Yeah. But I think a lot of people don't examine those choices. Yeah. They sort of they either burn out and opt out and say, I've no idea what to do, I'm not interested, I can't be doing with that. So they simply opt out, or they don't even think about it and they just go and stay on the conveyor belt. Yeah. So the way to address the balance for me is to encourage, discuss, enable, teach and support people to consciously examine their decisions, to say, what's my life going to be about? How am I going to get there? What are the advantages and what are the consequences, positive and negative, of me making that choice? And those debates, I don't know, correct me if I'm wrong, but I don't see us having those debates, Ross.
No, not very openly. One point you mentioned last time that I thought was really interesting was this idea of thriving instead of just coping, and it's something I've not really heard much of before. Can you describe and explain what you meant by that?
So I think one of the things that I see a lot of is this idea that we started off talking about work-life balance, yeah. So that's a classic thing that there's work, and I have to put up with work, because it gives me status, money, whatever, and sort of, and I do that, and then I use the money to do something else that I really want, and that work is a chore to be endured and something to be put up with, survived, and something to be coped with. Yeah, and the way that I see world, and right at the beginning, sort of when I said that my notion of the world is that work is one part of my life. Yeah, sort of, and there are other parts of my life. Yeah, but work is one part of my life, and I don't see why should I not enjoy work? Yeah, if I don't enjoy going running with my dog, well, I don't go running. Yeah, I make a choice. I don't want to go for a run. I don't go for a run. I've made the choice. Yeah, I mean, the consequences is the dog might chew the sofa. Yeah, but I've made the choice that has consequences. And sort of, and one of the things that with the idea of thriving careers for me is that instead of seeing work as burden that we have to survive, that we have to cope with, seeing work as somewhere where we can be ourselves, where we can enjoy interaction with the colleagues and people around us, where we can make a difference, and it's something that's enjoyable, yeah, and pays you a salary. So what is there not to like? You're doing something that you love, and you're getting paid for it, yeah. And in practical terms, achieving it is the things that we've already talked about. It's recognizing what is it that work gives me, yeah. Now, you might find that what work gives you is a salary, yeah, that's fine. But sort of, if the decision that you've made is that work gives me a salary which allows me to do X, Y, and Z, then that's an important thing to know about, because you go to work saying, okay, I'm enjoying being here because all the time I am earning money and status and prestige that allows me to do something else. Yeah, that's okay, but you have a reason for going to work. That reason might be money, but you have a reason to go to work. Yeah. And hopefully I'd encourage people to go back to what we said, this idea that you have every interaction you have is an interaction with a human being. You're interacting with your colleagues. I particularly enjoy working with the team around me, theatres particularly, yeah. So, that working in theatre is a very close-knit team. You tend to work with the same people all the time, and we have a wonderful team, and we have a wonderful time together. So I look forward to having that, and that for me is a pleasurable interaction. So for me, it's about trying to think as work as something that we put up with, as thinking work is something that we consciously choose to do. Yes, of course it has downsides, yeah, because it's not rosy all day, and we all have bad days and we all have terrible days, and all of us sometimes don't want to go to work, yeah. But fundamentally, work is something that we enjoy. We're making a difference, we're interacting with the people in front of us, and work is somewhere that ultimately gives us a rich and meaningful life.
Yeah, I really love that. So that's really your inspiration for your website as well, the Thriving Medics website.
Yeah, so I think if you like, my mission with that is instead of people tolerating their careers and being unhappy in careers, is I would be encouraging people to consciously examine what is it that they want to be doing with their life, make a choice. Yeah, that choice might be to leave medicine or switch specialty, whatever, but make a choice, accept the consequences that come with that. And most people chose to be a doctor for a reason. Yeah, so I know there are some people who want to leave medicine, but you kind of say, well, why did you do medicine in the first place? There must have been something that made you do it in the first place. Yeah, so for me, if you can get back to what was it that attracted you to doing medicine in the first place, and then converting an attitude toward work as something that's endured, and roadblocks to overcome, sort of creating a different relationship with work where you consciously choose, you examine who you want to be, what kind of a career you want to be, and then you create a career for yourself, and you create the kind to, the kind of relationships that you want to have, and and ultimately that's sort of something that then gives people a better career, in my view.
Hmm. Great, yeah. Well, thank you very much for sharing all these words of wisdom.
Thank you so much, and thank you very much for putting your website together, Ross, because I think it's a fantastic resource, for people at all stages of their career contemplating where their lives are going, and and recognizing that it's not just about being a zombie. We can do better than zombies.
Hmm.